Good morning, everyone. Can I have your attention, please? We're going to get started. I'm glad everybody can make it out today. We have our first speaker, Ms. Marion Bloom. She's going to introduce herself.
Well, thank you. You kind of did, but I will take it a little further. And you can also look up here. I am Marianne Bloom. I'm a nurse, and I am the founder and president of Ford Health International, and I will get back to that and how that was created and the vision behind it. But first, I want to just take a few minutes and just kind of like tap this in. I don't know if any of y'all have heard about tapping. I haven't really studied it myself, but I do, as a nurse, understand the nervous system. And I think that when you're tapping, go ahead and try it yourselves. I think that when you're tapping, it must stimulate your parasympathetic nervous system. And that is part of our autonomic nervous system that is the exact opposite of our sympathetic nervous system and our fight or flight response. And it brings balance and harmony to the body. It's kind of like goes in like a housekeeper and sweeps up the body and just puts everything back in balance. And I find that when I do that, I'm instantly calm. So I'll get back to that too. I want to talk a little bit about the nervous system. I'll be incorporating that the whole time as we're going through my story. But this morning, that's where I want to start. I want to start with my 23 years of experience. And this is a dream of mine because I have a lot of health information to share. So in 1993, I became a laboratory technician. And I loved that experience. I worked in hospitals and I worked in different physician offices. And I learned a lot about collaboration. I built a lot of great relationships. I also began to understand, as I studied chemistry and micro and immunology, I was even introduced to genetics at that time. And I began to understand the body at a very cellular level. And I realized through that 14 years, I just wanted more. I wanted to learn more. Just give me a minute, because I get very emotional because, like I said, this is a dream come true for me. So let me just kind of calm myself just a minute. This is another way you can calm yourself. Our body's amazing because there's just natural things that we can do that a lot of times are overlooked because the answer is always a pill. And that's what I began to realize as I entered the ER. For the first 2 years, I loved the ER. For the first 2 years, I just experienced everything and took it in. I was pushing a lot of medications. I was seeing great effects from medications, but I was also seeing a lot of negative side effects from those medications. And when I entered, it was really a time when the main focus was on pain control. Make sure your patient's pain is controlled. I think at that time, pharmacology were telling physicians that it was a compassionate thing to do, and it is. If you tell a healthcare worker to make sure your patient's pain is controlled, that's what we want to do. We want the best positive outcome. That's never been a question. That's why we do it. We do it because we're called to do it, and there's a compassion and an empathy there. So that wasn't difficult. So we started doing that. But then as the years went by, I look back now and reflect, there definitely became an increase in the ER flow, and there were changes that were made. You started seeing, when we were administering medicines, we'd have to put patients on a monitor. And we'd have to monitor their vital signs every 10 or 15 minutes. When patients came in for a conscious sedation, when their joint was, when their shoulder was out of joint, that was a 3-hour procedure because we would have to medicate that patient. There'd be a crash cart beside us. They'd be on a monitor, And so we'd have our little drug there, a little opioid, whether it be fentanyl, morphine, whatever it was, and then we'd have a thing in Narcan. And what I began to, what I know now, is that the same manufacturer of that drug, same manufacturer who made the opioid also made the Narcan to reverse it. So, still pushing the medication, started seeing a huge increase in overdoses, attempted suicides. The ER became a psychiatric ward. We would house patients for days, sometimes weeks. The tension from the patients became, it was very obvious. There was a lot of anger. There was a lot of fear. I even got punched and kicked, through all of that fear and anger, and the solution was always Geodon, Haldol, just some kind of psychotropic med. In hindsight, I think that made it worse. But I gave it because that's all I knew to do. Another story that I remember vividly in the ER was a side effect from a chemotherapy. And the lady came in and I could hear her out in the waiting room. She was vomiting. It was just wretched. And so we immediately got her back into her room. We got her on the monitor. We triaged her. We were putting in an IV, trying to control her vomiting. She was there maybe 3 or 4 hours, and we were giving her Phenergan, Zofran, Compazine, whatever you could think of to try to get her vomiting under control. And through all that vomiting, she would still smile, and she was begging me for a sip of Sprite. And it killed me not to be able to give her that sip of Sprite. But what happened eventually was, the more we still kept trying to get her vomiting under control. Eventually, her blood pressure started to drop, her oxygen level started to drop, and we tried to get her stabilized and get her to the OR. And she had breast cancer. She'd been on chemotherapy. That was the vomiting episode. So I found out a little bit later that day that she didn't make it. That the vomiting had actually caused her bowel to perf, and so her colon. Do you know what a perf bowel is? Okay. So that's what happened with her, and I started to see the same thing. I would see patients come in and I'd triage them, and of course I'd have to ask for a list of their medications. A lot of them listed side effects as allergies, so that would be very confusing for the physicians. A lot of them too would say, well, no, I'm not taking that medicine. Okay, well, that's prescribed to you by your cardiologist. Why are you not taking it? I don't like the way it makes me feel. Okay, and then I'd see evidence of that. I would see people that were, I remember a story of, he was about 37 years old. First time I met him, he came in by EMS, and they were doing chest compressions. So we were there with our crash carts and ready. So as I was waiting there for my turn to do the chest compressions, I was just kind of taking it all in and looking at him. I was like, wow, 37, but with all of the risk factors. You know, he was overweight. He had the apple belly, and the rest of his body was smaller. So I just remember thinking that, and then we worked on him for maybe an hour. We got him stable, got him up to ICU. I had heard he made it. He went home. That was great. Then I guess it was maybe a couple of months later, he was back in the ER. He was back in the ER with chest pain. And I was like, are you taking your medicine? Are you the medicine your cardiologist put you on? And he was like, no, I don't like the way it made me feel. I said, you were just in here. You just survived a heart attack. Why are you not taking your medicine? I just don't like it. So I lovingly tried to educate him and talk to him about the importance of taking his medication. And I felt pretty good. I thought he heard me. A couple months later, he's back in the ER. He's on the gurney. Chest compressions in progress. I couldn't believe it. I was just like, wow. And for just, human nature is just to make some kind of sense out of it. So, but long story short, he didn't make it. And it became a very difficult, I was in the ER for 7 years. And as I saw more of the negative side effects of the drugs, and I saw more overdoses, and the tension became higher. We feared for our own safety in the ER at times. And then also we started developing protocols where we would basically have the whole patient worked up and all the results before the physician would see the patient, because as all of this was occurring, healthcare costs was skyrocketing. So one of the solutions was cut staff. That's where you spend your most money. So cut the staff. Not a really good strategy, because that just makes it just created more anxiety, more pressure. So after a while, I realized I don't need to be in the ER anymore, because I started reacting more, and I started losing a little bit of my compassion, because I felt so much of the stress. I was barely keeping my head above water. So then I went into my second love, which was hospice. And where most people would see hospice as doom and gloom, I saw it as an opportunity to instill hope. And so that's exactly what I would do. I was a liaison. So I got to travel to all the different hospitals. I have so many stories. I met so many, took care of so many patients and families. And one of the things that I did was I would walk into the room, because you have to paint the picture for you. The physicians have just left. They've just told these patients there's nothing else Western medicine can do. These are imagine your loved one laying out. I don't know if you've ever been in that situation, but that's the situation I would walk into very often. But I would tell them, I would say, but you know what? This is an opportunity to really start living, and start living on your own terms. And if you want that bowl of ice cream, eat it. If you want the gummy bears, whatever makes you happy, spend time with your family. Think about what makes you happy. Focus on that. In the meantime, let's get you home. Let's get you support. Let's get your symptoms controlled, and just see what happens. Because I will tell you that I have seen people graduate the hospice program, and it does happen. So I felt better, because that's what I would give. I did not want to rob them from that hope. And another thing that I did, I was able to go and sit and read through those patients' charts. And I made it a priority to do that. I wanted them to know that I took that time to really understand their process and what they were going through physically. So from beginning to end, I'd read their chart. I'd read all their labs, I'd read their x-rays, and then I'd go in and I'd sit down and I'd say, let's just go along your journey, and you just clarify things for me. And I began to see that a lot, and I started linking it with being in the ER and triaging too, but I began to see that a lot of sickness, right before the disease process started, there was some kind of big stress. And I started seeing the link between fear and anxiety and stress and on the physical body. And that makes sense when you understand the nervous system. But I'll get back to that. But then I started to realize that why am I telling them, to think about quality of life? Why am I not doing it? Why are we all not living our best quality of life? Why do we have to wait for that point? So then then I started asking myself, what would make me happy? What do I want to do? And so that opened up a lot of avenues to meditation, yoga, and I started to realize when I was lifting weights and I was working out, what I was really doing was squeezing my lip, and that detoxifies us. I just started asking those questions. It was during meditation that I became it was a spiritual time for me. I started asking questions. I started getting very in tune with my body. And I realized that I was very, very sensitive to other people's feelings and emotions. And I could see it and feel it on their face and when I was standing around them. And I would find that I would start to take that on and carry that weight too. So as I was trying to heal myself and take care of my patients, I had also started struggling through some of my own health issues. And I was put on medication. And I was suffering through a lot of side effects from that. And I will get back to that as well. But so hospice, as I started to meditate, as I started to heal myself and ask for the answers, I ran across an article on PGX testing, which is short for pharmacogenomics. It is a combination of pharmacology and your genes. And based on your CYP 450 gene variations, a physician now has a tool. It's as close to personalized medicine as you can get. A physician now has a tool to determine not only what medicine is best for your body based on your DNA, but also how you metabolize it. So they know that it takes the guesswork out of what dose to give you. And I was like, this is my answer. This is my answer to my personal problems and then my dilemmas that I faced as a nurse. And I saw everybody in healthcare face. Everybody was suffering with cutbacks. So as healthcare went up and drug companies just made more and more money. I'm not saying that medicine is wrong. Medicine is a great thing if the right medication is given and it's the right dose. But if it's the wrong medication and it's the wrong dose, I've seen over and over for the last 23 years what the consequences of that is. And I've experienced it myself. So I ran across this article, and I joined a small organization, and it was commission only. But I was like, I believe in it. As a lab tech, as everything I saw, I understood it, and I knew what a great tool that it could be. So I left corporate. I left nursing after 23 years, and that was a difficult thing to do and risky because I was a single mom with 3 girls. Very risky. But I was at the point, I was at a breaking point, and I had no choice. And I started seeing my authentic self as I began to heal. And so I took that chance. And at first it was great. I was out there setting up accounts, and I got myself swapped. And Carly, if you want to go ahead and just cue that in, I want to share with you my results and how it empowered me. But before I do that, and she brings up all the list of medications, what I realized, those medications directly affect the nervous system. Now I'm going to show you how sensitive the nervous system is by doing a little bit of an energy test. So can I have a volunteer, someone who, really it can just be anyone, just to stand up. Yeah, come on, Brittany. Yeah. Yeah, I just want you to stand here and hold your arm out. Don't lock your elbow and just let your fingers. Yeah, I'm just going to test your energy first and just kind of see where we are. So I just want you to just push up as I push down. I'm not going to try to overpower you. Okay, you're good and strong. Good. Okay. Now I want you to think. I'm sorry to do this to you, but you'll get that. Now I want you to think about something that scares you or that causes you a lot of fear. And just kind of focus on that for a minute. Okay, all right. No, okay, I can relate to that. So as you're thinking about that, go ahead and put your arm out. I'm going to retest you. your fingers. Just focus on that a minute. See, that's how quickly fear, anxiety affects our energy. Now let me show you something that's really cool. So as you're thinking about that thing, I'm just going to touch your forehead here. I'm just going to kind of put my fingers here on your neurovasculars. Now I want you to think about the thing that caused you stress, and just let yourself go and just completely immerse yourself in it until you get. Yep. Until you get to the point to where it doesn't scare you no matter how much you think about it. My fingers are lightly touching her forehead, and what happens is as the blood is coming back up to her head, I will feel the pulse. Are you getting to the point to where you feel like it's not getting you down anymore?
I feel like I'm feeling good.
Good. Put your arm out there. Do the same exact thing. Right. Mm-hmm. You're strong again. So, when we put our fingertips on our neurovasculars, it's pretty cool, huh? No, that was it. Thank you very much. No, that works because our nervous system is so sensitive, and it's full of electrical pathways, and it senses not only things inside us but external as well, and it pulls all that information back up to the nervous system. So what happens is when you are frightened or sad, your sympathetic nervous system is activated. Let me just read to you some of the effects of the sympathetic nervous system response. See if any of y'all can relate to this. And you can, because I mean it can be a good thing if it's used in balance. But your increased heart rate, increased blood pressure, increased respiratory rate, your decreased gastric motility, decreased renal blood flow, and at the same time your blood is draining from your brain. When you get angry, sometimes that blood will come back in kind of your chest and your face. And then when you get scared, the blood drains to your legs, so you're ready to take off and run. But we are supposed to ebb in and out of our sympathetic and parasympathetic. We are not supposed to live in it. And we are in a world today where we live in it. Whether it is a result of medications that are stimulating it, or a toxicity of medications, or fears that are a result of all of the issues and the ethical problems in healthcare today. So let me go back and share with you and why I know how I could easily see this by looking at my test results and kind of going through my own personal experience. So this, Carla, if you just go to the second page, I mean, this is basically listing, this is basically the CYP2C9. These are the pathways that are analyzed. The drugs that the patients are taking, that's not what's tested. What we're looking at is the pathways that those drugs are metabolized on. So if you go next, one of the things, let's go to the antidepressants first, because that's when I was put on first. That was my first. So I went through a total hysterectomy in 2010. And so that sent me into menopause, which makes sense because it starts, all of your hormones are out of balance, and your hormones are what helps regulate your nervous system. So I began to suffer with what everybody suffers through with menopause, the hot flashes. You're losing your train of thought. And I felt like I lived in a sympathetic nervous, I felt like I lived in my sympathetic nervous system. And it would get worse because as I was educating my patients in the ER, I completely lose my train of thought. And that was terrifying for me. So I went to the physician and I started seeking for answers. And I heard, oh, you know, you can't do estrogen anymore. You know, everybody was trying to tell me what to do. And the physician even was like, no, the latest research says you need an antidepressant. Well, I had tried them in the past and had never had any positive results from them. But I said, okay, all right, I will try it, because he refused to put me on progesterone or any kind of hormones because of the risk. So I was just like, okay, I'll try it. So I don't know, probably a year just trying different antidepressants. I probably went through 7. And one or two things would happen. Either I would become a zombie and have no emotion whatsoever, or it just didn't affect me at all. And then I couldn't understand it. Everybody else was like, oh, I took my happy pill, I feel great. And I was like, well, it's not a happy pill for me. Why is it's not working for me? So I began to realize, once I saw my test results, that half of the antidepressants that I tried, this is what the doctor's going to see. They're going to see your medicines, it's in class. They're going to see your standard precautions in the green column, use with caution in the yellow column, and the consider alternatives in the red column. Well, what I began to notice was that the antidepressants that I was taking, either I was a slow metabolizer, and what that meant was that medicine was staying in my system longer, and my side effects increased and could have led to toxicity. But that's why I turned into a zombie. It wasn't that the medicine was wrong, the dose was wrong. But because it did that, it was like, oh, okay, we'll try something else. That cost a lot of money, a lot of time, and a lot of heartache. When I think of the domino effect of all of that. So, and then I noticed the other antidepressants that I was taking, I was a rapid metabolizer. That's just the opposite. That means those drugs went through my body so quickly, I never got any kind of therapeutic effect. And then when I started thinking about all the money, living paycheck to paycheck, and all the money I wasted on all those co-payments and everything, and trying all these medicines. And then, like I said, I felt like I was living in anxiety all the time, because I was just in fear. And I found that I couldn't concentrate, and I couldn't hold a thought for very long, and I knew I had a little bit of underlying ADD, but it was out of control. So I went back to the doctor, and I said, I need you to help me with this. I'm feeling like some white noise. I'm hearing some white noise. I'm having some problems with memory and paying attention, and I think it's just my ADD that's just come back, and just really adult ADD is what we hear it called now. So I was like, I guess I'm experiencing adult ADD. So they put me on Adderall. Well, the standard dose apparently for Adderall was 30 milligrams. And if I remember correctly, it may have even been twice a day. Regardless, it didn't matter. I took 30 milligrams and thought I was going to have a heart attack. My heart rate jumped to probably about 160. It became very difficult to breathe. And it scared me. And I knew that it was a medicine, and to just wait, and it would be out of my system, and it was okay. I knew what to watch for. I was a nurse. All right. And then, so the next time I was like, well, I won't do that again. I'll split it in half. So I don't know how many people do that, but I guess I felt like I could. And so I split it in half, and thank goodness I did, because I split it in half, and that was still too much. I was still experiencing that. So during this trial, I've noticed my personality was changing, and I was so impatient, and it started to affect all of my relationships. My relationships with my friends, my co-workers, my children, everything that was important to me and about my quality of life, it was beginning to affect. And so I'd get off of it. I'd be like, oh, I don't need it. I'd get off of it for a while. And then I'd be like, okay, well, I guess I do need it. And then I'd get back on it. So this was a roller coaster effect. I think this started around 2013. So this was like a roller coaster for 3 years. Then I saw on here that I'm a slow metabolizer. So, you know, it made perfect sense. So I had gotten myself down to 7.5 milligrams, still thought that was too much, looked at this swab, took the results back to my physician. He said, let's start you at 5. So I started at 5, and it worked. And I was like, yes. But then as I was still continuing to heal myself with other methods besides medicine. And now I'm off of it. Sometimes I think I may need it. You know, sometimes I still get jumbled, but you know, it's just a daily process. But I am off of it, and I feel better than I've ever felt. And so then I just wanted other people to have this knowledge and be empowered. So I was out there, I was visiting physicians' offices, and physicians loved it, and they wanted it, and I was getting it in their offices, but they had some concerns, and I wasn't sure what their concerns were at the time, and for some reason, they really didn't want to voice them to me. But I think that at the time, now that I speak to some other physicians, they were worried about all the fraud that's out there. Because the unethical practices and the Medicare fraud, the fraud all around just absolutely blew my mind. And and I started to realize it was actually stopping PGX from progressing. Because Medicare believes in the test, and commercial insurance, they could see the benefit of it. And initially Medicare was paying 100%. Then you'd have the small organizations who would go out there and hire account managers on a 1099 commission only. They had nothing to lose. And they'd get them, and me, that was what I was, you know, and they'd send us out there. And I began to see research studies that were out there that were unethical. And as soon as I became aware of it, I left the company and didn't have anything to do with any of the people that were in it. And the company dissolved. And the lab that they were using was grinded to a halt and put under investigation. So now I had physicians' accounts who had patients that were experiencing psychosis, and they needed these results, and they were not able to get them. So that was very disheartening to me. I didn't set out to start my own business, but I realized that if I wanted a business with integrity and honesty, and a business that really could understand the benefit of the PGX and believe in it as much as I did, that's what I needed. So I started Forward Health International, and I wanted to make sure that it also combined the mind, body, and spirit. And it wasn't just about medication, but it was the closest thing I could see for personalized medicine to make sure that patients were safe. So regardless of all of the obstacles, I couldn't let it go. So I did develop this, and I did find a lab. I started looking for labs, and labs, a lot of them are a lot more privy to it, but some of them will contract with anyone. But I didn't want just any lab. I had to have a lab I could trust. So I researched, and I found a lab that was founded by physicians. And the experience that these physicians have, the genetic experience that they have, their vision for furthering the genetic research and bringing other services into physicians' offices, and their goal of keeping down healthcare costs and really improving patient outcomes. I went and met with one. I went and met with one of the doctors. I spoke with them, personally met, and it was just it was like kindred spirits. It was without a doubt. And I was like, okay, all right, now I can move ahead. But I didn't know if my dream was even going to happen if I couldn't find that lab. So that is my vision. I want to take this service back into the physician's offices. I want to alert you to some of the fraud. Some of the things that you can look for. The physicians would call me, once my lab was on hold, I did not want the physicians not to have those results for their patients. So I was like, if somebody else comes in, you know, go with them. Go with their lab. Keep swabbing your patients. Then I started getting phone calls. Well, I'm not getting my results. Patients are coming in with bills that are anywhere between $2,000 and $20,000. So what I was beginning to realize was some of these labs were double, triple, quadrupling what the insurance was paying out. I don't really know how they get away with that, but apparently they can. So that was another thing that I made sure, you know, with this lab, because as with anything, when you see the advantage of something and you know the impact that it can make in healthcare, you're gonna have a lot of greed and corruption out there initially. So it doesn't mean you need to do away with the technology. It just means we need to be more aware of the red flags. So the coding now is definitely a big help with that. The ICD-10 codes help a lot with that. I never told even though I think PGX could be beneficial for everyone, right now, if you're experiencing side effects or you feel like your medicine's not working for you, it's for you. It's for you. If you're struggling, if you feel like that, you know, you're living in this sympathetic nervous system state, it could help. It can help as a Band-Aid, as something to control a symptom. But then I think that's as far as Western medicine can take it. Then we have to go back to holistic medicine and Eastern philosophies. Meditation can also be termed prayer. Whatever terminology you want to use, is getting in touch with who you are spiritually, getting to know your body, getting to understand your nervous system, the feelers that you put out, and how you affect people. And there's little exercises you can do that. And I want to bring the whole combination into physician offices. And this lab is not just focused on getting the service in, they're focused on the continuation of making sure that those outcomes are good, because they're developing an app that now the patient has access to their lab, to their genetic lab report at any time. So as they're going to specialists, they can say, here's my lab report. The app also asks the patient, are you still taking the medication? Did your physician change the dosage? Or are you still taking it after the dosage was changed? Are you feeling better? And all of these questions, all of this data is being collected just to help further the research. And that does need to be done, because there's so many genetics, because it's so personalized. I mean, it's endless what it could do. Pretty soon we're going to be able to devise our own diet plan based on our genetics. I mean, I can easily see it. Why are we sticking with a one-size-fits-all mentality anymore? It's not. We're as individual as our DNA, as our fingerprint. None of us even have the same birthday. That's how individual we are. So, and I also noticed that as this combination of Eastern and Western medicine was utilized, that I started realizing more of what I term my authentic self. Have you heard that term? That's just where self-doubt starts to leave you. And all of those things, all of those little messages in your head that you may have heard anywhere from childhood on, that you don't even realize. They're just registering in your in your subconscious. And then you start to take that on, and it starts to become you. And it is not you. It is a lie. All of those negative things that you've ever heard, that's not you. The you that was created, yes, we've got some weaknesses, but that's what life is about. It's a journey to strengthen those weaknesses, to grow and to become the best that we can be. So that is what I want to bring. I want to encourage Eastern philosophies. I realize that when you're doing yoga, you're actually stretching your body and you're making more room for energy to flow. And as a nurse, I became very aware that we are energy. It takes an electrical current to run through your heart before you can be shocked back to life. Our nervous system is nothing but electrical impulses. So it's just as important to have our energy flow be uninterrupted as it is our blood flow. But we're getting there. It really is more of a global thing, and it already is in the north. It's a little slow coming to South Carolina, but I think it will get here, and I think that we'll be able to see a big difference, and that we will even be able to walk outside and feel it. Because as you feel better as individuals, you're putting off that good energy. Those self-doubts are vanishing. You're feeling confident. You're recognizing the gifts that you were given at birth, and you're using those gifts. And you feel more energized and more alive, and that is the definition of quality of life. That's what it is, and that's what I want. So what I want to do is, do we have time for questions?
Yes.
Does anyone have any questions about PGX? Have any of you heard about it? None of you had ever even heard about it? What had you heard about it?
I work at a psychiatric hospital.
Oh, okay.
I know there's a psychiatrist here in town who is outpatient practice, does testing.
Oh, okay. Have you heard about what he thinks and how it's helping him, or?
We have patients who come in the hospital and bring their test results or have them sent over, so that's about all I know about it.
Okay.
It's exciting to think that there is a possibility of not just throwing every medication at the patient as quick as you can, but there's actually
There just needs to be a balance. You know, that's why I think that healthcare is just suffering so much. It's just so out of balance. And right now, to me, it seems like it's being run by medicine and pharmacology. And they're making an awful lot of money. And at the same time, they're costing us a lot of money, personally, through healthcare. So this is not the answer, but it is a great tool, and it is a great starting point. So let's use it. Another thing that this app does is, as you're changing your medications, it will redo your whole genetic profile and how it would change based on if you change that medication. It lets the physician know of inducers and inhibitors that can also affect your metabolic pathway. And I also began to realize even if the medicines aren't listed on the test, I began to realize that I could CYP any medicine. I take L-lysine over the counter. It's great for fever blisters, if y'all don't know. But I started to wonder, if I was taking too much of that, all these holistic alternative meds out there on the market right now, I started to wonder, is that affecting me? So I just CYP'd L-lysine, and I could see what pathway it utilized, and then I could go back to my test, and Carly, if you just go to that first page, I think it's one more back. Yeah, I could see what pathway it utilized, and then I could go back and look at if I was a slow or a fast metabolizer, and then I could figure out. It's tricky, but it can be figured out. But I know that science will advance it to the point to where it will be even a more valuable tool. But the genetic information won't change. Your DNA is the same until from the day you're born until the day you die, unless you have a liver transplant. Other than that, it's not going to change. That's another great tool about this. If you go back, and let's look at some of the drugs in my red column. Okay, let's see if this was it. Well, here's my Lexapro, and I was actually a rapid metabolizer of that. But even, let's go one more. I noticed one of them, I just noticed that Abilify was one of the drugs I should never take. I started thinking, wow, it's a good thing I know that now, because probably about the time I'm 90, they're going to be saying, you need Abilify. So now I know, no, I can't take that drug. I don't metabolize it. It's not going to give me any kind of a benefit. So that's great knowledge to have too. So I think the test that you're talking about is a psych profile that just covers maybe the psychotropic drugs. What I like about this is that it covers them all. It covers all your cardiac drugs, all your psychotropic drugs. This one actually was a psych panel that I did on me, but I would have loved to have had it all. So I feel pretty healthy now though. But you know, in the future, it would be nice to have that information when I walk into my physician. So I'm surprised just one person in here has heard about PGX. Before I left hospice, I'd gather as many hospitalists as I could. I thought, what do you think about this? And I started showing a lot of them that I showed them a chart where their CYP 450 medications, they may be prescribing Lexapro. That doesn't work. And then they would prescribe another antidepressant, but it fell under the same pathway. So if first medicine didn't work out of that pathway, the second medicine certainly wouldn't. And that was information that they loved to have because it would have saved them a lot of time. They don't enjoy the guessing game any more than, you know, we as patients enjoy going through it because they genuinely care. For 23 years that I've worked with physicians and anyone in healthcare, I've never met anyone that didn't care about the patient and their outcome. You know, just like human nature and with everything, everyone's overall goal in healthcare is the good outcomes. So I just really believe strongly that this is a great tool and it's going to take us very far. As a matter of fact, one of the physicians that have founded the company that I'm working for, he is working on new genetic pathways to help predict addiction. And also there's a pathway that deals with alcoholism and finding out your blood alcohol concentration and factoring that into the metabolism process. And I think that when that's studied a little more, we'll actually be able to come with a preventative plan. Because one of the things that I saw in hospice that was so heart-wrenching, with the effects of psychosis, I would see alcoholics housed in hospital rooms for weeks, months, maybe even years. Families would just desert them. And then, you know, we would be treating them and trying to keep them calm with drugs. With the Geodon and the Haldol and the Dilaudid and put them and restrain them. And I would go in and I would see them and their briefs and through psychosis they'd be pulling at their brief and eating their feces and you just see all kinds of crazy things and people, you know, with overdoses. So the science that this is heading in, my desire is to see it help all that as well. And with these physicians and their visions, I started seeing the links and talking to them. They're already working on them. And that excites me. So do y'all have any other questions about PGX? Yeah.
You mentioned about Medicare
Mm-hmm.
kind of covering it.
Yeah.
What about just, you know, a person that wasn't on
Well, it really needs to be available to everybody, regardless of whether you have insurance or not. And I have talked with my lab about this because I've had some of the physician concierges want to include it in their price. So when you come in and you join them, they'll have that included in the package. So for people that can't afford it and don't have insurance, this lab will do it for $350. And legally, that's really ethically as low as you can go. Some labs might do it cheaper, but they're doing some unethical things to balance that out, and there may be some red flags. There may be other red flags later.
But insurance may cover it.
Insurance is still covering it. It is. Medicare is still covering it. Not as much as they were, but they are still covering it. They just kind of backed off a little bit. But I think if we get it back out there with the right apps, we're gathering the data, and we're doing it ethically, that it can really be pushed forward and make a huge difference in healthcare. And it can be the start of the answer of cutting down healthcare costs. Any other questions or comments? Yes.
Are you finding physicians in this area open to it and using it in their practices?
I am. I have Partner MD that's using it, Galen Healthcare is using it, Emergency MD, they were starting to use it, and then that's when my lab with the small organization fell apart. I faced about every obstacle out there, I think. I've really learned I'm very resilient, but it's just because I believe in it so much. But there's also Foothills, internal medicine and orthopedics and Easley that's been using it as well. And I just talked to my sister the other day, and she was telling me that now her pediatrician in Charlotte was using it. And so I'm like, oh, okay, well, ask him, what he thinks about it, if it's helping him in these patients. And that's when she told me that he had encountered a bill that was $20,000. And he said that he valued the test so much that he wanted to continue it, but it sickened him at knowing what was out there. And I think eventually under that, anybody would have to say, okay, no, let's get rid of it. You know, regardless of how it can help, eventually seeing that, you're going to shut it down. And you should, because those labs will be shut down eventually. So it's okay. It doesn't dishearten me anymore, because I know that Medicare is on top of it, and I know that eventually when you work like that and unethically like that, you're going to hang yourself. It's just a matter of time. And then any other questions or comments? Did y'all learn anything that you didn't know, or okay, well, good. Well, then I feel like that it was successful then. I do want to, I'm sorry, someone have a card? Yes, ma'am, I do have a card for you. I wanted to end on a really positive note though, because I go back to the tapping. And they say that when you tap like this and you're remaining in that parasympathetic, that you're actually retraining your nervous system to stay in that state longer. And I read a research experiment that blew my mind, where they took 6 mice, they put them in a cage, they would shake the bottom of the cage and at the same time infuse an apple blossom scent. Well, what they noticed was, of course, over time, they just infused the apple blossom scent and they would react with fear without the cage being shaken. We all know that happens. The interesting thing is they brought in 6 female mice, they bred them, and their offspring reacted to the apple blossom scent without ever being exposed to the bottom of the cage being rattled. Not only did their offspring react to the apple blossom scent, but 6 generations down. So when we try to go through our psyche and figure things out, I've just always asked a lot of questions and figure things out. We don't have the answers. That's deep in our genes. I mean, things could go way back beyond our control, but we don't have to let it define us. And we can learn to recognize it and use those senses to begin to heal ourselves and ask questions and use medicine to help control those symptoms. But in the meantime, let's get to the root of what's really causing the illness. And Carla, you can put it up there, I highly recommend this book. Don't let the title throw you off, because if you want to understand really the combination of mind, body, and spirit, and how it can truly lead you to your authentic self and lead you to complete well-being, this is an excellent book. It's a spiritual book, so don't, but it encompasses, like I said, everything. It is a great read. Another great read, Donna Eden, Energy Medicine. When I was in hospice and I was working with the patients and the families, and I was beginning to feel their pain and healing myself with energy medicine, I started healing the families. And I started using it. I was like, okay, well, this is helping me. Maybe this will help you. And then I started with the patients, and I started getting really good outcomes. I got really excited about it. Mary Jane will remember that, because it was a great tool. But really what it was doing was, I could get into clearing chakras. Y'all have to kind of delve into that a little bit. But I do understand it's energy stations, and it goes back to our genetics. Even that goes back to our genetics. It all goes back to that. So if we can understand that, that is a powerful tool for prevention and health. So like I was going to leave you with this song, because when you're tapping and you are, I think it's the vibration in this song. It's the most humanitarian song, and the lyrics are exactly what I want to project onto the world and what I feel in my heart.
And it's on our singles album, 1969 to 1973. And it's called Top of the World.
If this song don't make you happy, then I want you to put yourself in the touch. Let's retrain. You can get up and dance too if you want.
Such a feeling's coming over me. There's wonder in most everything I
We'll
see.
be wondering everything.
Like a cloud in the sky, got the sun in my eyes, and I won't be surprised if
You
it's
just
a
close
dream.
your eyes and just melt into
Anything I want the world to be is now coming true, especially for me. And the reason is clear, it's because you are. You're the nearest thing to heaven that I've seen. I'm on the top of the world, down on creation, and the only explanation I can find is the love that I found ever since you've been around.
When it's talking about love, that's a universal love. Romantic love's great, but it doesn't mean universal love.
Something in the wind has learned my name, and it tells me that things are not the same. It's the leaves on the trees and the touch of the breeze. There's a pleasing sense of happiness for me. There is only one
Okay,
wish
now
on
if y'all are
my
enjoying
mind.
that, you can keep doing that as long as you want to. I highly recommend that you continue it throughout the day. You continue it throughout. It is a daily thing. Sometimes I still wake up with anxiety, and when I'm starting to feel anxiety, I start tapping. I start tapping. I start activating my immune system. It's instant. It's instant energy. If you're feeling extremely anxious and depressed, and when you walk backwards and you're having energy tests going on you, and your arm goes down, you're going back and reset your energy. Okay, while you're listening to that, whoever asked me about my business cards, they are over. I'll have them over here this table. You're welcome. Please come get one. Thank you.
in my flash drive.
What?
He is saying that it is not taking it.
USB device not recognized. Is that it?
It says it's not recognizing it.
Miss Marion, you getting ready to leave?
No, I'm gonna hang out and listen to the other speeches.
Okay.
More information, I know that.
The better.
Yeah, I think.
It's not recognizing it.
I just never done this before. Installing. Shall have software not successfully installed.